So hospital outbreak management, there are a few steps here. First of all, what is an outbreak? Okay. Occurrence of two or more similar cases relating to place and time is identified either as a cluster or an outbreak. Both are same. Okay. Or even outbreak is occurrence of disease exceeding the expected level for any given population within a specific time frame. Time frame is very important here. Okay, within a specific time frame, maybe it is 1 day, 2 day, or within a week, you are seeing similar cases. Okay, more of similar cases which in that given population was not that common to happen, but it's happening. So that could be an indicator of an outbreak. So this needs to be investigated, okay, to discover what was the route of transmission. How is it, how uh, how communicable is this disease? What is the way through which this infection is spreading in the community? Okay, what are the possible sources of infection as well? Okay, in order to apply preventive measures, you have to need this data. You have to understand this data. Only then you can uh, put specific preventive measures. Until then, you have to work with general preventive measures. Okay, and specific preventive measures work much better. But until and unless you know the route of transmission, okay, you are sure of the route of transmission, you will have to sustain with general preventive measures. Okay, so outbreak can happen in two ways: steady increase in the cases or large number of cases. Okay, either it is person to person spread or common source outbreak. So steady increase in cases, what happens? Today you saw one case. After 2 days, two other cases came to the hospital. After 2 days, more cases are coming to the hospital. So steadily, day by day, more and more people are getting affected. So that is an indicator of a person to person spread. One person, infected person, through him or her, the infection has been spread to somebody else. After incubation period, that person also came into the hospital. Okay. So that is person to person spread. Large number of cases together, if they come to the hospital around the same time, that's an indicator of common source outbreak. Okay, too many cases. Within 2 3 days, your hospital is flooded with too many cases showing same signs and symptoms. That is a shared exposure. From one common source, everyone got infected. It could be food poisoning, okay, or cholera. Okay, cholera also happens in large numbers together. It bursts out. One common source could be the common source of cholera, and that community gets affected. Okay, so these are the two ways of how an outbreak can spread. So steps to investigate an outbreak. Okay, in investigation, who all will be the team member, what has to be done by each one of them, where you have to go and find the data, why do you need this specific data, by what time the data completion should be done, and how you will proceed further. These answers has to be, you will have to find the answers to these questions. So step one is recognize an outbreak, recognition of an outbreak and confirming the outbreak. So, and once you recognize the outbreak, you have to notify it to the public health authorities. Case definition has to be made. Okay, infection control measures to prevent further transmission has to be put into place. Okay, these all things will come into place. And then how do you recognize an outbreak? As I mentioned, 2 or 3 cases. When the cluster appears, that's the red signal for an outbreak that has been happening. Okay, so you have to investigate the blood samples, urine samples, and other samples has to be investigated to confirm that the same kind of agent, causative agent, has caused all these signs and symptoms. Okay. Am I audible to all? So preliminary investigation, as I mentioned, laboratory results will be checked properly to confirm it is the same causative agent, same bacteria or same virus or same microbiome is causing the infection, not it is not from different sources. Okay. So those things will come under preliminary investigation. Determine the magnitude of the problem, how far, to what extent the community has been affected. Is it a very small number of cases that you are treating with, or similar cases have started getting admitted in other hospitals as well? Okay, you have to determine that also. You have to connect with the surrounding hospitals in your area, public health facilities, private health facilities. Get connected with them and determine, are they also seeing the same kind of outbreak within their hospitals. Okay, now you will verify the diagnosis. Once you determine that other hospitals are also getting the same cases and it is the same causative agent, so based on that agent, which system is affected? Is it the respiratory system, GI system, urinary system? Which system is affected? Okay, you have to verify that. Okay, you have to identify that, and then you will make a diagnosis. Okay, then once the diagnosis is confirmed, you will confirm an outbreak, and this news will be given to the public health authorities. Okay, that an outbreak has been confirmed. Okay, and step 2, once everyone has been notified, public health authorities, hospitals, general public, everyone has to be notified that there is an outbreak. Okay, health education schemes will be started, it will be started shared on the mass media. Okay, so that general public is aware. During that time, step 2 will be carried out in the hospitals. So notify and involve appropriate departments, personnel, and hospital administration. You will require the help and aid of bureaucracy, law enforcement, ministries, health ministries, municipalities. Okay, all the healthcare fraternity within your area, they all have to come together, and their involvement should be appreciated to take further steps to control the outbreak. So that is, even mass media, the media has to be informed. Okay, they also have to be notified, and media involvement is also appreciated to spread the news. Okay, step 3, search for additional cases. You have to catch each and every case. You don't want to let any infected individual in the community and put others at risk. So search for additional cases. Okay, let the community know if anyone is facing these signs and symptoms, immediately come to the hospital. Okay, clinical and microbiological records will be kept for all the additional cases that come to the hospital which exhibit the same kind of signs and symptoms. Everyone's clinical and microbiological sampling and all the sample results will be recorded. Okay, then line listing will be made. Line listing you can do in Excel, one by one day after day. When new patients arrive who exhibit the same signs and symptoms, their name, contact number, address. Okay, one by one, as soon as you get the patient, you add this patient details into an Excel sheet. That is line listing, as simple as that. In a tabular format. Okay, the patient's name, contact details, address, from which area they are coming from. Okay, why line listing is important? Because you will be able to identify who was the uh, cause of spread, from whom did this person may or may not have got the disease. Okay, just to get that details, just to make the network of cases, line listing is important. Okay, then develop an epidemic curve. This is the epidemic curve. Okay, x-axis will have the time since the first case was seen, date will be mentioned, okay, here, and y-axis will have the number of cases. So you can see here two epidemic curves have been shown, one without any protective measures and one with protective measures. Okay, in without protective measures, you can see how steeply the cases increased, how quickly the cases increased, and how many people were involved. Okay, and it came down fairly. In the second curve, you can see when protective measures were used, personal protective equipments were used, there was an increase in the case, definitely, but it was very slow, very controlled. Okay, and very less number of people were affected. Okay, just give me one moment, 1 minute. So these are the two epidemic curve, one without protective measures and what with protective measures. Then you have to formulate a hypothesis. So before starting on your investigation, you will have to formulate a hypothesis. You have to make an assumption. Okay, so this could be the causative agent. Okay, like for example, even before the COVID virus was diagnosed, okay, it was confirmed. The species of the virus was confirmed. There was an assumption that based on the signs and symptoms people are exhibiting, this is something very similar to SARS outbreak. And SARS also was a coronavirus or different form of coronavirus. Okay. And then COVID-19 was also the same species, but a different virus. Okay. But before everything was confirmed, before the conclusion was made, there was an assumption this could be. So you have to formulate a hypothesis. Okay. Is this a SARS virus? Is this a different form of a swine flu virus? Okay. Is this a different form of H1N1 infection? Okay. Or yellow fever, dengue? Is this a different kind of a vector-borne outbreak? So you have to formulate a hypothesis. Okay. And then that will give you direction to move forward with the outbreak. Then microbiological investigations will come into play. Each and every case that you have line listed, their samples, blood sample, urine sample, swabs, throat swab, nose swab, if it is a flu kind of case, swabs are required. So all these investigations will be documented well. Microbiological investigations are the core evidence that will suggest towards a species of outbreak. Then testing of the hypothesis will be done. Once you have formulated the assumption, now you have the microbiological investigation. You analyze, and either you will be proven right or wrong. Whatever your assumption was before you started the investigation, okay, Either it will be true, your assumption was correct, or your assumption was wrong. Okay, it is based on case control study, cohort study, microbiological study. So in detail, you don't have to study about case control or cohort. I'll just give you a brief introduction to case control and cohort studies. So case control studies is like you have two groups, case group and control group. Case group are the people who are affected with a disease. Control group are the group of people who do not have any disease yet. Okay, you study both of them at different intervals of time to identify what would be the reasons that led gave them a disease, gave the case group a disease, and there was a small interruption, sorry. So what was the reason case case group has a disease, and what is the reason control group does not have a disease? What is the difference in these two groups? So that when you do that kind of a research, it's a case control study. Cohort study, you have a group of people, one group of people, you follow them over a period of time. It takes long periods of time to complete a cohort study. You have a group of people, you follow them over a period of time to see if they develop a disease or not. Based on their disease pattern, behavioral pattern, lifestyle choices, do they get a specific disease in the future or not? Okay. When you do that kind of study, it's a cohort study. These are cohorts, group of people who have everything same. Maybe their genetics are same, they are the same population, they have the same ethnicity, they are the same age group. Okay, so these factors are same, and you follow them over a period of time to see after 5 years, after 10 years, what kind of disease conditions they are catching. Okay, based on their lifestyle choices. That is cohort study. Then microbiological study, from the name itself, you collect samples, you analyze the sample, you record the results. Okay, and you come to conclusion. Okay, so that is a microbiological study. So these studies will either prove your assumption, or it will um, deny your assumption. Okay. Step 4, once you identify your assumption have been proven right or wrong. Okay, once that has been as identified, once the conclusion is in your hand, which kind of disease it is, which kind of route of transmission is this outbreak, now you can implement specific control measures. Till then you were using general control measures, okay, like hand washing, wearing mask, gloves, okay, face shields, everything you were using. Once you know exactly what is the route of transmission, you don't have to use all the PPE. You just have to use specific control measures, okay, because you will understand, is this outbreak a contact based, direct contact based outbreak, droplet, or airborne. Okay, so based on that, specific control measures can be implemented, okay, without wasting resources. Monitor for further cases and effectiveness of control measures. Even you have applied your control measures by book and by theory, your control measures are right, but sometimes it may not work. The cases are not coming down, the cases are still increasing. So there is some issues with the effectiveness of your control measures. Okay, by theory it is correct, but maybe your personals, your employees are not following the control measures properly. That could be the reason. So you have to monitor these areas. Then prepare report for hospital infection control committee. You have to prepare report for the hospital infection community on a daily basis until and unless the outbreak is under control. Daily hospital infection control committee meeting will be held to find any non-compliances in infection control. Okay, effectiveness of infection control. Okay, number of cases exceeding day by day, to discuss that. So on a daily basis, infection control committee meeting will be held, and you will have to be ready with the report. Involve all departments of the administration. Infection control committee does not only mean only the clinical side of the hospital. Heads of the departments from the clinical side should be the part of this meeting. Even the head of the departments from the administrative part of the hospital should be available on this meeting. Next is intermediate control measures. Okay, so general measures which you usually use when you do not know the source or the root: strict hand washing, environmental cleaning, hygiene, intensifying this 3 times a day, 4 times a day. You will put your housekeeping staff to do the cleaning and maintain the hygiene. Adhering to aseptic protocols like using gloves, creating an aseptic environment to carry out the routine procedures, strengthening your disinfection and sterilization. CSSD will work full fledged. Okay. Sometimes double sterilization will have to be done. Okay. So these are intermediate control measures, general measures. When you do not know the proper source or route of transmission, these areas will be very strictly followed. Appropriate antimicrobial use, routine disinfection, okay? Removing any indwelling devices as soon as possible. Proper use of personal protective equipment. These are the control measures. 1 second. Next, microbiological study. This is carried out to identify possible sources and routes of transmission. So in microbiological study, as we discussed earlier, microbiological studies are done. So what do you do in microbiological studies? The microbiologist, they are responsible for this, but as an infection control officer, you should know, you should have an awareness of what cultures from which part of the body, parts of the patients, how it has to be sent. Okay, these are the areas an infection control officer should be knowing about. Okay, so cultures from body sides of the patient, cultures from body sides of other patients, the infected patients and other patients also, you have to send the cultures. Okay, cultures from the staff who were rendering care to the patients, cultures from the environment where the patient was admitted. Okay, the patient who had the outbreak infection, they were admitted. Okay, these cultures has to be collected and sent, labeled properly and sent to the sent for microbiological study. Okay, when from all these areas, from all these 4 areas, you find the same causative agent, you find a common agent that is common in all these cultures, that becomes your causative agent. Okay, specific control measures, this needs to be instituted on the basis of nature of agent, characteristics of the high risk group, and possible sources. Based on these 3 areas, you will select the specific control measures. And what does it include? First, identify and eliminate the contaminated product. Maybe if it is a water source, okay, a single water source that led to the outbreak. Stop using that water source. Okay, put on flyers that do not use this water source. Take it away. Eliminate that water source or water filter. Okay, modification of nursing procedures. If the nurses are not following proper protocols, strengthen your nursing staff, strengthen the nursing skills. Okay, be strict with the nursing procedures. Identification of treatment of carriers in hospitals. During outbreak, you have to scan all the visitors and patients if they are carrier of any disease condition or not. Okay, rectification of lapse in clinical technique or procedure. If at all there was any error, medical error, in any clinical treatment that you give or the procedure that you give, it has to be rectified and made sure that other staffs also know about this lapse and they don't commit the same error. Okay. Evaluation of efficacy of control measures. So control measures should be evaluated by a continued follow-up of cases after outbreak. Measures are clinically effective if cases cease to occur. Okay, when cases stop one by one, cases decrease one by one after a specific period of time, that's when you say the whatever measures you took was effective. Outbreak should be documented and record should be kept with the hospital infection control committee, and it should be presented in the hospital infection control meeting as well. So that's about outbreak management. If you have any queries, you can mention in the chat